I'd like to welcome you to this edition of the award-winning PRS Journal Club podcast with your hosts, Drs. Francesco Egro, Nicole Phillips, and Ira Savetsky. Enjoy.
Hi there, and welcome to the April 2018 PRS Journal Club podcast. My name is Nicole Phillips. I'm one of the PRS resident ambassadors from the Harvard Plastic Surgery Program. I am joined for this month's discussion by my co-ambassadors, Ira Savetsky from NYU and Francesco Egro from the University of Pittsburgh, as well as our guest moderator, Dr. Amanda Gosman. Dr. Gosman is Chief of the Division of Plastic Surgery and Director of Craniofacial and Pediatric Plastic Surgery at the University of California, San Diego, as well as Director of their Plastic Surgery Residency Program and their Craniofacial Fellowship Program. We are so grateful to have the contribution of amazing faculty members like Dr. Gosman to these monthly conversations. Dr. Gosman, thank you so much for joining us today.
My pleasure.
So before we launch into our discussion, I want to remind our listeners that all of the articles we discuss as part of the PRS monthly podcasts are always available for free online, so please go check them out there. There are also selected pairings that have been chosen to go with these articles, and those are also available online at the PRS website. So, in light of the recent Me Too and Time's Up movements, our next article for discussion is particularly timely. Entitled Factors Affecting Women's Success in Academic and Private Practice, and authored by Drs. Shah, Haws, and Kalliainen, this article is the latest in a PRS special topics series dedicated to women's issues in plastic surgery. I selected this article in part to highlight this series, which I really applaud the editors of the journal for putting together. The goals of the article are encapsulated in the title, and each piece of this is examined independently. Factors Affecting Women's Success in Academic and Private Practice. The authors start by considering the definition of success. How is this measured? How do we know if we're successful? Success, it turns out, is defined both by objective, goal-oriented achievements, such as income, job title, honors, and awards, but also by internal satisfaction. Are we happy with our job? Do we like going to work every day? What motivates us to continue seeking out success, however we define it? And does the practice environment, whether that be academic, private practice, or employed position, influence and support our achievement of success? I think, and the authors agree, that yes, of course, the practice model affects these factors. The question is, which type of practice is best suited to any individual's personal definitions of success? How can trainees and new graduates sort through the options to find the career path best suited to them? And does gender play a role in this? The authors then go on to detail potential advantages and opportunities of private versus academic practice, as well as the perceived disadvantages and barriers to success. I'm not 100% sure I agree with every distinction that was drawn between the different practice models. For instance, I think something like mastery of surgical technique is probably a universal goal for all surgeons. I did appreciate the opportunity to learn from the perspective of three authors who have navigated various practice models. To briefly review their conclusions, the authors suggest that academic practice offers freedom from the business side of medicine, prestige, interesting patients and case mix, and the opportunity to engage in meaningful research pursuits. The downsides of academic medicine listed include its lack of support and mentorship for women, expected participation in administrative and organizational activities that can negatively impact work-life balance, and possibly decreased earning potential. The perceived benefits of private practice include greater autonomy and more control over time management and work-life balance, while potential downsides include the stresses of running a business and heavy call responsibilities. Finally, the authors highlight several key features in achieving success, regardless of the practice model pursued. These include support and mentorship, negotiation skills, opportunities for promotion, leadership opportunities, and institutional change supporting the above. As a chief resident about to graduate in 4 months, these topics have been weighing heavily on my mind as of late. This article, as well as the selected pairings, has certainly given me some food for thought, although there are also parts of the conversation that I have found a little frustrating. I want to make clear that this was not due to any fault of the authors, but I think it's due to the nature of the topic itself. For me, this article highlights the challenges inherent in the conversations that are happening on local and national levels, looking at questions of sexual harassment, gender-based discrimination, and compensation inequalities. One of the parts of this article that I really liked was the avoidance of generalizations. I agree with the author's assertion that satisfaction and success will be defined by each individual's internal value system rather than by their gender. I personally am always very aware of the concern that I might appear whiny or difficult, but I also believe in the importance of these conversations. I do think that there are challenges that are specific to women within both academic and private practice settings, and I thought that this article might have glossed over some of these in an effort to avoid these concerns. Although the article was entitled Factors Affecting Women's Success, I largely thought you could have removed the references to women throughout the article without changing the overall message too significantly, with the exception of the key features in achieving success, which did have a gender-based focus, particularly the personal stories that the article concluded with, which I really enjoyed. So Dr. Gosman, I'd love to get your thoughts on this. How can we start to talk openly about these differences? And is there a way we can frame these conversations to be open, honest, and engaging without fear of alienating our male colleagues or shooting ourselves in the foot?
That's a great question, and definitely a huge challenge. I think that it's very important we look at our educational paradigm and how we're training people in medical school and certainly in residency to really incorporate from the very beginning education about the value of inclusion, diversity, and bias into our curriculum for everyone, so that it doesn't come out later in life where you're complaining about I'm not being treated fairly, but that everybody starts to change the way that they look at how decisions are made and how participation is kind of really being optimized. And I think that this, is definitely true for inclusion of women, but I think, of a lot of underrepresented groups, that there's a lot of good literature to support the value of diversity in every single aspect. And I think that this just needs to be like a core component of our education, and particularly not something that's just discussed in women's groups or kind of side channels, which can be very important for venting and kind of trying to figure out how to organize. But I think that it's very important that this is brought out and addressed across the board, not just when women are given the opportunity to speak about it. One of the things that I did recently here at our institution, there was a great talk that Julie Park actually gave at one of our 8 CAPS retreats about issues regarding leave and equality and bias, and actually brought her out to be a grand round speaker to our entire department of surgery. And I think it was very eye-opening to the entire department to kind of just start to understand things about implicit and explicit bias and start that kind of educational process. But I think when you're speaking in that forum, it's almost too late. We need to figure out ways to really just have a different lens as we look at how we want to structure our workplace.
Absolutely. I couldn't agree more. So I want to bring the boys into the conversation, of course. The reason why I wanted to bring this paper to this setting and have a conversation like this about it is because I think the journal put out this series, which is wonderful. And then I've been to a bunch of talks like the one that Dr. Gosman was just talking about, where we're sort of having these break-off sessions, but I really wanted to try and pull it more into the spotlight and have a conversation between, all the different groups that this affects. And certainly, Francesco, I would love to hear what your thoughts are on this, because I think they're just as important and just as valuable as mine.
Thanks, Nikki. I agree with you. I think it's fantastic that the journal has this series now on gender bias, and I feel that this article was well written, extremely topical, and it is important not only to flag the current discrimination issues, but also to find ways to solve them. And I think the authors did a good job to discuss key topics relevant not only to women, but frankly to, male surgeons too, since it's a two-way street. And just as the authors mentioned, I think the goal should be to mitigate barriers that prevent women from achieving personal and career goals, whatever they may be. And to me, this is the most important issue. The current plastic surgery community should provide equal opportunities regardless of gender or race. And this paper highlights the current disparities and offers practical advice on how to approach them. I really feel the issue with gender discrimination comes down to access. And right now I can think of access to opportunities, access to equal pay, access to adequate maternity leave, access to good mentorship, and so on. And I feel we're very lucky to be able to discuss this article with you, Dr. Gosman, because as a surgeon, you have reached all the academic milestones. I mean, Nikki introduced you with, I don't know how many titles, from professorship to chief of specialty, chief of division, program director, and fellowship director. And having gone through all the levels of academic leadership, I was wondering if you could share key tips for female residents wanting to follow a successful academic career like yourself.
Well, thank you. I appreciate that comment. I think, it's interesting when I reflect back. I mean, there's definitely been some challenges. I remember when I finished my training, I was specifically given advice to never join any of the women's plastic surgery groups. This was, of course, by a male mentor, because I actually didn't have any female faculty or any female mentors maybe till a couple years ago. And I was told that I would never be taken seriously. So I didn't join any of these women groups. And, I always kind of had a vision of where I wanted my career to go. And that was kind of integrating a lot of both my clinical and research interests, and a lot of that is also related to some of my global health interests. So I was always a little bit on a different pathway, which just seemed to work out okay. But I definitely noticed along the way that a lot of the work that was being done by women was a little bit kind of as this aside. So, it's wonderful that this whole issue was put together. It would also be great to have these types of articles just show up in the regular, like as maybe a section in the journal routinely, talking about how we can all improve our understanding of our own personal bias, because it's not just about our own careers and what we face as practitioners as men and women, but it also really impacts how we treat our patients. And that's why I think, it's such a critical element to really incorporate into education at every single level. I think that things have definitely gotten a lot better, and I think that just starting with awareness is tremendous. But I would ask both of our male colleagues here now, how is it that men would actually be interested in attending sessions like this at national meetings when we talk about things like diversity and inclusion and bias? How do we actually incorporate men into that discussion in a way where we can mutually be educated on all of our limitations to make the workplace more equal, but also to make the treatment of our patients really more egalitarian?
I speak for myself, but I've attended sessions and meetings on this very issue, and in fact, I'm also involved in research in this very specific issue. I think it's something that has to be discussed, but also in practical terms, I think things have to happen. So starting from residency, for example, how there is professionalism sessions, at least that's what we have here for our conferences. There should also be these topics discussed as separate sessions. Also, something that we haven't really touched much about is maternity leave. It's something that I feel very strongly that it should be not only improved nationwide, which obviously this is a big leap, but at residency level. I'm from Italy, and there women get 6 to 12 months maternity leave. I've did my medical training in England, and I've trained with plastic surgery residents who found solutions to take maternity leave part-time. So basically they would come back part-time and work part-time, and they were able to combine it with another resident. So that's how it worked out for them. But I think as an organization or as a community, I think these issues should be tackled on a practical level. And I don't know if there are any easy solutions from a logistical standpoint, financial standpoint, funding, and so on. But some direction has to come from our societies. And that's not only the ASPS, but also from ACAPS. So the organizations that tackle not only the plastic surgery community, but also our training. I don't know what your thoughts are on this.
Yeah, I've had the good fortune to be involved in some of these discussions, certainly on the ACAPS level, as there has been a lot of pressure to expand the flexibility of our leave policies. And that did actually recently improve. You may not realize it, because a lot of this actually comes down to the American Board of Plastic Surgery requirement for having time in training. So up until I think it was a year or two ago, residents are required to be actively enrolled essentially for 48 weeks of the year. That was just lessened in response to a lot of protests and concern about not just maternity leave, but any type of leave. People who are being treated for illness or family leave or all sorts of leave. And that was made more lenient so that in the final year, it can be up to only 46 weeks. So there's some flexibility, but still it's clearly not adequate to allow for appropriate time off after having a child.
Truthfully, I feel that female surgeons are super women. I've just had a baby, and my wife took a couple months off, but she's not a surgeon, so she doesn't have that kind of level of stress or physical activity. I see surgeons who are pregnant and still operate until the day before of their delivery and then just jump back in and work right away. To me, that's crazy.
It is crazy, and it's dangerous, actually, for the mother and for the baby. And that's some of the kind of, when you look at that literature, is really interesting, because all the problems with miscarriages and having high-risk pregnancy and all those things are compounded by working in that relatively unhealthy manner up until the day that, you're going to deliver, and then certainly jumping right back into the workplace. So this is something we still need to make a lot of progress on. And again, it's been very frustrating to try to advocate for that. And there is still a very old school mentality on the part of our training paradigm that, it's really not designed for women getting pregnant. So I think that this is something we need to continue to advocate for reform. I think that it needs to be much more flexible. I think looking at alternative pathways or even hybrid pathways of training, such as I know you guys are looking at the competency-based model, and that certainly has pros and cons, but one of the huge advantages is that it does provide a lot of flexibility for these things, because you're in training, but life happens, and we need to be able to, in order to really retain the most talented people in our field, that we need to be able to really be flexible and accommodate for different needs of different people from different backgrounds.
Dr. Gosman, thank you so much for your comments. I think I spoke too much, and I'll get Ira involved. What did you think of the paper?
First of all, thank you, Francesco, for taking the lead of representing the men on this podcast. This has been an unbelievable discussion, and the comments have been outstanding. I agree with everything that was said. I think, making changes within our residency programs, having dynamic speakers like yourself, Dr. Gosman, and others come give sort of grand rounds about this topic, I think, is certainly a good start. And then certainly at the national level, there's no question that this should be brought to the forefront. As for myself, this year has been quite introspective in terms of what type of work environment do I see myself being in, and, taking into consideration that I'm a husband and I'm a father of 2 young girls, certainly I value certain things, such as any other resident, with regards to prioritizing, family, in addition to trying to be the best plastic surgeon I can be. It's not an easy answer. And at the same time, we are really all biased by the institutions that we train in. To say that I know what happens at Pittsburgh or San Diego or, Mass General, it's very hard for me to know exactly what goes on there and what type of environment it is there. Just for some perspective, here at NYU, we have, out of the 15 full-time faculty members, 4 are women, and of those 4, 2 were recently hired in the past year or so. Of the 21 residents, 6 are female. As a whole, I think we are making progress in terms of attracting more female faculty. Certainly more needs to happen. Dr. Gosman, being a female chief of plastic surgery at a major academic center, what are some of the key elements that an academic institution must do in order to attract more female faculty? I know we touched upon. Is there anything else that you think would be key to recruiting more female faculty?
That's an excellent question, and hopefully something that I think a lot of leaders will continue to kind of ponder, so that we can address this definite glass ceiling issue that seems to be occurring. I think one of it is having females in leadership. For me, again, in my residency training, there were no female faculty at all, and I felt like I had great male mentors along the way. But I think that having women in leadership and supporting women to have academic careers at academic centers where they're given equal pay, it's pretty straightforward things, but they're actually not happening even, at our institution. It was looked at recently, and we're still paid significantly less than men for the same kind of levels. So I think making sure that there's equal pay, that there are equal opportunities for academic career development in terms of research support and access to different resources that will help them to foster their career is really critical. Another thing that I think is really, really important that I feel like I learned a little bit the hard way is having good sponsorship of female faculty. So mentorship is one aspect where, you can help to develop someone's career. But having someone who's a sponsor is equally, if not more important, somebody that's going to put women who are, excelling in their field up for positions of leadership, of participation in important decision-making committees, whether it's within your institution or on a national society, I think is absolutely critical. I remember, many times in early academic practice trying to volunteer for many activities within our societies and feeling like I was pretty invisible, where I would see colleagues sitting nearby who were continually promoting and sponsoring men, promoting their male colleagues, and advancing way quicker in terms of being able to really play an active role in these important activities. So I think sponsorship, finding not just mentorship, but sponsorship is very important. I feel like I didn't really get an opportunity to participate on the level that I would like to have until some of my male peers really reached a level where they were sponsoring me. So I think that's something important to kind of think about when, who are the people whose names are offered up when, they're looking for leaders or committee members and things like that. So creating those pathways, not just removing barriers, but actually actively recruiting people into those types of positions, especially people that women and, men or people from any background that are demonstrating, leadership qualities to get them on those tracks is really critical.
All right. Well, I think this has been a really tremendous discussion. We could certainly keep on going, but for the sake of podcast timing, I think we'll wrap it up here. I want to thank everybody for a fantastic discussion, and I think personally, just having the conversation is really the first step in the right direction. So thank you to everyone for participating. I would like to remind our listeners to look out for the other 2 PRS podcasts this month. And if you like what you hear, please feel free to share it with your colleagues. And don't forget to rate us in the Apple iTunes Store. Please join us as well for our monthly online journal club on Facebook, where you can interact with our featured authors in real time. You can also like the PRS page if you have not done so already. And I'd like to give a big thank you again to Dr. Gosman for joining us today.
My pleasure. Thank you so much for the invitation. It was really great spending this time discussing all these great articles with all of you. You're really inspiring for the future of plastic surgery. So best of luck to all of you.